Health officials in British Columbia said earlier there is a presumptive case of the illness in that province. That means there's now one confirmed case in Canada, that one's in Toronto, and two presumptive cases, also in Toronto and now in BC. Canada's Health Minister, Patty Hajdu, learned of the new case while she was speaking to reporters in Ottawa. She says the risk to Canadians is still low.
It's good to know that they've confirmed the case. We were waiting for that confirmation, and I would say the same thing that I just said 2 minutes ago, that it's a sign that the system is working. When we can confirm cases quickly, when we can actually do the appropriate investigations, that's when we know that we can contain the spread. The more we know about who may have traveled to the region and who is symptomatic, the better it is for us as a system.
Megan Batchelor is watching the latest on the Canadian coronavirus cases. She joins us now from our Vancouver newsroom. So Megan, what did health officials there say about this new case?
Well, Andrew, we know that it is a man in his 40s. He travels quite a bit to China for work, and in particular, he had recently been to Wuhan City, and he arrived back in Vancouver last week. And we know that officials are still calling this a presumptive case, as we cannot officially consider it a case of coronavirus until those results are back from the microbiology lab in Winnipeg. However, health officials are quite confident that this is a case of coronavirus, just given the fact that he was, in fact, in Wuhan City, widely considered to be ground zero of this virus, and also just given what his symptoms were. Officials also took an opportunity today to commend this latest patient, saying he did all the right things once he started showing symptoms. Take a listen.
He's a gentleman who was well aware of what was going on in China, and when he returned, he went home and he voluntarily self-isolated, so he had not traveled outside his home until he sought medical attention, and he did that with all the appropriate precautions that we're aware of. So there are a small number of contacts that including family contacts, and Vancouver Coastal Health is following them and is confident that they have everybody that has any concern about being in contact with this individual.
And of course, as with other cases that we're hearing about, concern over who might have been on the plane around him. People may be concerned if they flew back with him. However, officials say that he wasn't showing symptoms until the day after his flight, and you're not contagious until you start showing symptoms, is what the officials said, so there should not be any concern around that. Health officials were contacted on Sunday about this case. The test results came back late last night confirming this case of presumptive coronavirus. The health officials here in BC say that they have been bracing themselves for this. They had been preparing, and now they are getting in touch with some of his family members, but the number of people that he's been in contact since his symptoms started showing is quite limited, thanks to him being proactive, Andrew.
And so that brings the total to two presumptive and one confirmed case.
Yeah, that's right. So we know that we have the confirmed case in Toronto, another presumptive case there as well, and now this latest one. However, the World Health Organization is saying on its website that there are two confirmed cases in Canada. CBC News, though, has not been able to confirm just which case they are considered to now be a confirmed case. So we know also that in Ontario, they are investigating a few other people. I believe it's 19 other people in terms of possibly having the virus. Here in BC, officials say they are also investigating a few other people. There are lab results being done and awaiting those results, but officials here in BC wouldn't give the exact number of people that they are now looking into, but they are encouraging anyone who has traveled to that region showing any symptoms to get in touch with health officials. Of course, here in BC, they're saying that, and across the country, Andrew.
All right, Megan, thank you.